The Accelerated Bachelor of Science and Nursing program from Averett University lets you earn your nursing degree in as few as 16 months. If you have prior college experience, our multiple start dates and rolling admissions process let you start nursing school sooner. There's no wait list, and you can apply if you have any bachelor's degree or at least 60 college credits in any field.
Averett University's Accelerated Bachelor of Science and Nursing program in Norfolk, Virginia lets you earn your nursing degree in as few as 16 months.
This program is very fast-paced, which means I'll be done in a very short amount of time.
Between essential prerequisites, professional instruction, and valuable clinical experiences, you'll be ready for diverse opportunities in nursing. Consider Averett as a fast track toward your future in nursing.
The Accelerated Bachelor of Science and Nursing program from Averett University lets you earn your nursing degree in as few as 16 months. We offer learning options to fit your busy life, and with 3 start dates every year, classes are always starting soon. There's no wait list, and you can apply if you have any bachelor's degree or at least 60 college credits in any field.
Aaliyah, an ABSN student at Averett University, relied on a few keys to success as she went through her challenging yet rewarding nursing journey.
Remember why you want to be a nurse. Make sure you have a great support system to help you achieve your goal.
Her dream is to make a difference in people's lives, and she's achieving that every day. We believe you can too.
Hey everyone, welcome to Averett University. Here at our Norfolk site, we have our Accelerated Bachelor of Science in Nursing program, where a student can earn their Bachelor of Science in as little as 16 months. I'm excited to show you around. This is our student lounge. This is where our students are able to come relax, study in groups, and enjoy a nice lunch. And this is our debrief room. This is where, after your simulation lab, you're going to go over your footage with yourself and your instructor so that way you can have a third-party perspective on your own performance. This is our simulation lab, and this here is Sim Mark. He's a high-fidelity mannequin that's capable of responding to what you do and physically moving around. So here, you'll be given a scenario, like for instance, Mark could have a heart attack, and it's going to be up to you to determine the best way to treat him and potentially save his life. And while you're working on Mark, you're actually going to be observed behind a two-way mirror, where your instructor is going to be able to observe your performance and physically control how the mannequin is reacting to you. Now, this is our testing room. This is where you'll complete your standardized exams that are structured similarly to the NCLEX exam. You'll be completing it under the guidance of our testing coordinator, so that way we want to make sure you're as successful as possible. And this is our dedicated study room. Anytime the building is open, you can use this space to study either by yourself or with a group to make sure that you always have a safe and quiet place to study. And this is our skills lab. This is where you're going to be practicing the everyday skills you're going to be using as a registered nurse, from assessing the patient, inserting IVs, wound care. You'll receive one-on-one help from your instructor thanks to our small class sizes.
Lindsay, an Accelerated Bachelor of Science in Nursing student at Averett University, chose the 16-month ABSN program to earn a nursing degree in an accelerated time frame.
I'll be done in a very short amount of time. I'll have a degree and a certification that I can move to different states with.
Fast-track your nursing career. Aaliyah Rivers found a supportive learning environment that could help her efficiently achieve her nursing goals through Averett University's 16-month ABSN program.
I did not want to go back to school for 4 years. Having this as an option was very appealing to me. I know it's going to be very rewarding at the end of it.
Aaliyah chose the path she knew was right for her, and you can too.
Accelerated Bachelor of Science in Nursing program from Averett University lets you earn your nursing degree in as few as 16 months. If you have prior college experience, our multiple start dates and rolling admissions process let you start nursing school sooner. There's no wait list, and you can apply if you have any bachelor's degree or at least 60 college credits in any field.
Averett University's Accelerated Bachelor of Science in Nursing program in Norfolk, Virginia lets you earn your nursing degree in as few as 16 months.
This program is very fast-paced, which means I'll be done in a very short amount of time.
Between essential prerequisites, professional instruction, and valuable clinical experiences, you'll be ready for diverse opportunities in nursing. Consider Averett as a fast track toward your future in nursing.
The Accelerated Bachelor of Science in Nursing program from Averett University lets you earn your nursing degree in as few as 16 months. We offer learning options to fit your busy life, and with 3 start dates every year, classes are always starting soon. There's no wait list, and you can apply if you have any bachelor's degree or at least 60 college credits in any field.
Aaliyah, an ABSN student at Averett University, relied on a few keys to success as she went through her challenging yet rewarding nursing journey.
Remember why you want to be a nurse. Make sure you have a great support system to help you achieve your goal.
Her dream is to make a difference in people's lives, and she's achieving that every day. We believe you can too.
Hey everyone, welcome to Averett University. Here at our Norfolk site, we have our Accelerated Bachelor of Science in Nursing program, where a student can earn their Bachelor of Science in as little as 16 months. I'm excited to show you around. This is our student lounge. This is where our students are able to come relax, study in groups, and enjoy a nice lunch. And this is our debrief room. This is where, after your simulation lab, you're going to go over your footage with yourself and your instructor so that way you can have a third-party perspective on your own performance. This is our simulation lab, and this here is Sim Mark. He's a high-fidelity mannequin that's capable of responding to what you do and physically moving around. So here, you'll be given a scenario, like for instance, Mark could have a heart attack, and it's going to be up to you to determine the best way to treat him and potentially save his life. And while you're working on Mark, you're actually going to be observed behind a two-way mirror, where your instructor is going to be able to observe your performance and physically control how the mannequin is reacting to you. Now, this is our testing room. This is where you'll complete your standardized exams that are structured similarly to the NCLEX exam. You'll be completing it under the guidance of our testing coordinator, so that way we want to make sure you're as successful as possible. And this is our dedicated study room. Anytime the building is open, you can use this space to study either by yourself or with a group to make sure that you always have a safe and quiet place to study. And this is our skills lab. This is where you're going to be practicing the everyday skills you're going to be using as a registered nurse. From assessing the patient, inserting IVs, wound care. You'll receive one-on-one help from your instructor thanks to our small class sizes.
Lindsay, an Accelerated Bachelor of Science in Nursing student at Averett University, chose the 16-month ABSN program to earn a nursing degree in an accelerated time frame.
I'll be done in a very short amount of time. I'll have a degree and a certification that I can move to different states with.
Fast track your nursing career. Aaliyah Rivers found a supportive learning environment that could help her efficiently achieve her nursing goals through Averett University's 16-month ABSN program.
I did not want to go back to school for 4 years. Having this as an option was very appealing to me. I know it's going to be very rewarding at the end of it.
Aaliyah chose the path she knew was right for her, and you can too.
Accelerated Bachelor of Science in Nursing program from Averett University lets you earn your nursing degree in as few as 16 months. If you have prior college experience, our multiple start dates and rolling admissions process let you start nursing school sooner. There's no wait list, and you can apply if you have any bachelor's degree or at least 60 college credits in any field.
Averett University's Accelerated Bachelor of Science in Nursing program in Norfolk, Virginia lets you earn your nursing degree in as few as 16 months.
This program is very fast-paced, which means I'll be done in a very short amount of time.
Between essential prerequisites, professional instruction, and valuable clinical experiences, you'll be ready for diverse opportunities in nursing. Consider Averett as a fast track toward your future in nursing.
The Accelerated Bachelor of Science in Nursing program from Averett University lets you earn your nursing degree in as few as 16 months. We offer learning options to fit your busy life, and with 3 start dates every year, classes are always starting soon. There's no wait list, and you can apply if you have any bachelor's degree or at least 60 college credits in any field.
Aaliyah, an ABSN student at Averett University, relied on a few keys to success as she went through her challenging yet rewarding nursing journey.
Remember why you want to be a nurse. Make sure you have a great support system to help you achieve your goal.
Her dream is to make a difference in people's lives, and she's achieving that every day. We believe you can too.
Hey everyone, welcome to Averett University. Here at our Norfolk site, we have our Accelerated Bachelor of Science in Nursing program, where a student can earn their Bachelor of Science in as little as 16 months. I'm excited to show you around. This is our student lounge. This is where our students are able to come relax, study in groups, and enjoy a nice lunch. And this is our debrief room. This is where, after your simulation lab, you're going to go over your footage with yourself and your instructor, so that way you can have a third-party perspective on your own performance. This is our simulation lab, and this here is SimMark. He's a high-fidelity mannequin that's capable of responding to what you do and physically moving around. So here, you'll be given a scenario, like for instance, Mark could have a heart attack, and it's going to be up to you to determine the best way to treat him and potentially save his life. And while you're working on Mark, you're actually going to be observed behind a two-way mirror, where your instructor is going to be able to observe your performance and physically control how the mannequin is reacting to you. Now, this is our testing room. This is where you'll complete your standardized exams that are structured similarly to the NCLEX exam. You'll be completing it under the guidance of our testing coordinator, so that way we want to make sure you're as successful as possible. And this is our dedicated study room. Anytime the building is open, you can use this space to study either by yourself or with a group to make sure that you always have a safe and quiet place to study. And this is our skills lab. This is where you're going to be practicing the everyday skills you're going to be using as a registered nurse. From assessing the patient, inserting IVs, wound care. You'll receive one-on-one help from your instructor thanks to our small class sizes.
Lindsay, an Accelerated Bachelor of Science in Nursing student at Averett University, chose the 16-month ABSN program to earn a nursing degree in an accelerated time frame.
I'll be done in a very short amount of time. I'll have a degree and a certification that I can move to different states with.
Fast-track your nursing career. Aaliyah Rivers found a supportive learning environment that could help her efficiently achieve her nursing goals through Averett University's 16-month ABSN program.
I did not want to go back to school for 4 years. Having this as an option was very appealing to me. I know it's going to be very rewarding at the end of it.
Aaliyah chose the path she knew was right for her, and you can too.
The nursing program from Averett University lets you earn your nursing degree in as few as 16 months. If you have prior college experience, our multiple start dates and rolling admissions process let you start nursing school sooner. There's no wait list, and you can apply if you have any bachelor's degree or at least 60 college credits in any field.
Averett University's Accelerated Bachelor of Science in Nursing program in Norfolk, Virginia lets you earn your nursing degree in as few as 16 months.
This program is very fast-paced, which means I'll be done in a very short amount of time.
Between essential prerequisites, professional instruction, and valuable clinical experiences, you'll be ready for diverse opportunities in nursing. Consider Averett as a fast track toward your future in nursing.
The Accelerated Bachelor of Science in Nursing program from Averett University lets you earn your nursing degree in as few as 16 months. We offer learning options to fit your busy life, and with 3 start dates every year, classes are always starting soon. There's no wait list, and you can apply if you have any bachelor's degree or at least 60 college credits in any field.
Aaliyah, an ABSN student at Averett University, relied on a few keys to success as she went through her challenging yet rewarding nursing journey.
Remember why you want to be a nurse. Make sure you have a great support system to help you achieve your goal.
Her dream is to make a difference in people's lives, and she's achieving that every day. We believe you can too.
Hey everyone, welcome to Averett University. Here at our Norfolk site, we have our Accelerated Bachelor of Science in Nursing program, where a student can earn their Bachelor of Science in as little as 16 months. I'm excited to show you around. This is our student lounge. This is where our students are able to come relax, study in groups, and enjoy a nice lunch. And this is our debrief room. This is where, after your simulation lab, you're going to go over your footage with yourself and your instructor, so that way you can have a third-party perspective on your own performance. This is our simulation lab, and this here is Sim Mark. He's a high-fidelity mannequin that's capable of responding to what you do and physically moving around. So here, you'll be given a scenario, like for instance, Mark could have a heart attack, and it's going to be up to you to determine the best way to treat him and potentially save his life. And while you're working on Mark, you're actually going to be observed behind a two-way mirror, where your instructor is going to be able to observe your performance and physically control how the mannequin is reacting to you. Now, this is our testing room. This is where you'll complete your standardized exams that are structured similarly to the NCLEX exam. You'll be completing it under the guidance of our testing coordinator, so that way we want to make sure you're as successful as possible. And this is our dedicated study room. Anytime the building is open, you can use this space to study either by yourself or with a group to make sure that you always have a safe and quiet place to study. And this is our skills lab. This is where you're going to be practicing the everyday skills you're going to be using as a registered nurse. From assessing the patient, inserting IVs, wound care. You'll receive one-on-one help from your instructor thanks to our small class sizes.
Lindsay, an Accelerated Bachelor of Science in Nursing student at Averett University, chose the 16-month ABSN program to earn a nursing degree in an accelerated time frame.
I'll be done in a very short amount of time. I'll have a degree and a certification that I can move to different states with.
Fast track your nursing career. Aaliyah Rivers found a supportive learning environment that could help her efficiently achieve her nursing goals through Averett University's 16-month ABSN program.
I did not want to go back to school for 4 years. Having this as an option was very appealing to me. I know it's going to be very rewarding at the end of it.
Aaliyah chose the path she knew was right for her, and you can too.
The nursing program from Averett University lets you earn your nursing degree in as few as 16 months. If you have prior college experience, our multiple start dates and rolling admissions process let you start nursing school sooner. There's no wait list, and you can apply if you have any bachelor's degree or at least 60 college credits in any field.
Averett University's Accelerated Bachelor of Science in Nursing program in Norfolk, Virginia lets you earn your nursing degree in as few as 16 months.
This program is very fast-paced, which means I'll be done in a very short amount of time.
Between essential prerequisites, professional instruction, and valuable clinical experiences, you'll be ready for diverse opportunities in nursing. Consider Averett as a fast track toward your future in nursing.
The Accelerated Bachelor of Science in Nursing program from Averett University lets you earn your nursing degree in as few as 16 months. We offer learning options to fit your busy life, and with 3 start dates every year, classes are always starting soon. There's no wait list, and you can apply if you have any bachelor's degree or at least 60 college credits in any field.
Aaliyah, an ABSN student at Averett University, relied on a few keys to success as she went through her challenging yet rewarding nursing journey.
Remember why you want to be a nurse. Make sure you have a great support system to help you achieve your goal.
Her dream is to make a difference in people's lives, and she's achieving that every day. We believe you can too.
Hey everyone, welcome to Averett University. Here at our Norfolk site, we have our Accelerated Bachelor of Science in Nursing program, where a student can earn their Bachelor of Science in as little as 16 months. I'm excited to show you around. This is our student lounge. This is where our students are able to come relax, study in groups, and enjoy a nice lunch. And this is our debrief room. This is where, after your simulation lab, you're going to go over your footage with yourself and your instructor, so that way you can have a third-party perspective on your own performance. This is our simulation lab, and this here is SimMark. He's a high-fidelity mannequin that's capable of responding to what you do and physically moving around. So here, you'll be given a scenario, like for instance, Mark could have a heart attack, and it's going to be up to you to determine the best way to treat him and potentially save his life. And while you're working on Mark, you're actually going to be observed behind a two-way mirror, where your instructor is going to be able to observe your performance and physically control how the mannequin is reacting to you. Now, this is our testing room. This is where you'll complete your standardized exams that are structured similarly to the NCLEX exam. You'll be completing it under the guidance of our testing coordinator, so that way we want to make sure you're as successful as possible. And this is our dedicated study room. Anytime the building is open, you can use this space to study either by yourself or with a group to make sure that you always have a safe and quiet place to study. And this is our skills lab. This is where you're going to be practicing the everyday skills you're going to be using as a registered nurse, from assessing the patient, inserting IVs, wound care. You'll receive one-on-one help from your instructor thanks to our small class sizes.
Lindsay, an Accelerated Bachelor of Science in Nursing student at Averett University, chose the 16-month ABSN program to earn a nursing degree in an accelerated time frame.
I'll be done in a very short amount of time. I'll have a degree and a certification that I can move to different states with.
Fast track your nursing career. Aaliyah Rivers found a supportive learning environment that could help her efficiently achieve her nursing goals through Averett University's 16-month ABSN program.
I did not want to go back to school for 4 years. Having this as an option was very appealing to me. I know it's going to be very rewarding at the end of it.
Aaliyah chose the path she knew was right for her, and you can too.
The nursing program from Averett University lets you earn your nursing degree in as few as 16 months. If you have prior college experience, our multiple start dates and rolling admissions process let you start nursing school sooner. There's no wait list, and you can apply if you have any bachelor's degree or at least 60 college credits in any field.
Averett University's Accelerated Bachelor of Science in Nursing program in Norfolk, Virginia lets you earn your nursing degree in as few as 16 months.
This program is very fast-paced, which means I'll be done in a very short amount of time.
Between essential prerequisites, professional instruction, and valuable clinical experiences, you'll be ready for diverse opportunities in nursing. Consider Averett as a fast track toward your future in nursing.
The Accelerated Bachelor of Science in Nursing program from Averett University lets you earn your nursing degree in as few as 16 months. We offer learning options to fit your busy life, and with 3 start dates every year, classes are always starting soon. There's no wait list, and you can apply if you have any bachelor's degree or at least 60 college credits in any field.
Aaliyah, an ABSN student at Averett University, relied on a few keys to success as she went through her challenging yet rewarding nursing journey.
Remember why you want to be a nurse. Make sure you have a great support system to help you achieve your goal.
Her dream is to make a difference in people's lives, and she's achieving that every day. We believe you can too.
Hey everyone, welcome to Averett University. Here at our Norfolk site, we have our Accelerated Bachelor of Science in Nursing program, where a student can earn their Bachelor of Science in as little as 16 months. I'm excited to show you around. This is our student lounge. This is where our students are able to come relax, study in groups, and enjoy a nice lunch. And this is our debrief room. This is where, after your simulation lab, you're going to go over your footage with yourself and your instructor, so that way you can have a third-party perspective on your own performance. This is our simulation lab, and this here is Sim Mark. He's a high-fidelity mannequin that's capable of responding to what you do and physically moving around. So here, you'll be given a scenario, like for instance, Mark could have a heart attack, and it's going to be up to you to determine the best way to treat him and potentially save his life. And while you're working on Mark, you're actually going to be observed behind a two-way mirror, where your instructor is going to be able to observe your performance and physically control how the mannequin is reacting to you. Now, this is our testing room. This is where you'll complete your standardized exams that are structured similarly to the NCLEX exam. You'll be completing it under the guidance of our testing coordinator, so that way we want to make sure you're as successful as possible. And this is our dedicated study room. Anytime the building is open, you can use this space to study either by yourself or with a group to make sure that you always have a safe and quiet place to study. And this is our skills lab. This is where you're going to be practicing the everyday skills you're going to be using as a registered nurse, from assessing the patient, inserting IVs, wound care. You'll receive one-on-one help from your instructor thanks to our small class sizes.
Lindsay, an Accelerated Bachelor of Science in Nursing student at Averett University, chose the 16-month ABSN program to earn a nursing degree in an accelerated time frame.
I'll be done in a very short amount of time. I'll have a degree and a certification that I can move to different states with.
Fast track your nursing career. Aaliyah Rivers found a supportive learning environment that could help her efficiently achieve her nursing goals through Averett University's 16-month ABSN program.
I did not want to go back to school for 4 years. Having this as an option was very appealing to me. I know it's going to be very rewarding at the end of it.
Aaliyah chose the path she knew was right for her, and you can too.
A nursing program from Averett University lets you earn your nursing degree in as few as 16 months. If you have prior college experience, our multiple start dates and rolling admissions process let you start nursing school sooner. There's no wait list, and you can apply if you have any bachelor's degree or at least 60 college credits in any field.
Averett University's Accelerated Bachelor of Science in Nursing program in Norfolk, Virginia, lets you earn your nursing degree in as few as 16 months.
This program is very fast-paced, which means I'll be done in a very short amount of time.
Between essential prerequisites, professional instruction, and valuable clinical experiences, you'll be ready for diverse opportunities in nursing. Consider Averett as a fast track toward your future in nursing.
The Accelerated Bachelor of Science in Nursing program from Averett University lets you earn your nursing degree in as few as 16 months. We offer learning options to fit your busy life, and with 3 start dates every year, classes are always starting soon. There's no wait list, and you can apply if you have any bachelor's degree or at least 60 college credits in any field.
Aaliyah, an ABSN student at Averett University, relied on a few keys to success as she went through her challenging yet rewarding nursing journey.
Remember why you want to be a nurse. Make sure you have a great support system to help you achieve your goal.
Her dream is to make a difference in people's lives, and she's achieving that every day. We believe you can too.
Hey everyone, welcome to Averett University. Here at our Norfolk site, we have our Accelerated Bachelor of Science in Nursing program, where a student can earn their Bachelor of Science in as little as 16 months. I'm excited to show you around. This is our student lounge. This is where our students are able to come relax, study in groups, and enjoy a nice lunch. And this is our debrief room. This is where, after your simulation lab, you're going to go over your footage with yourself and your instructor, so that way you can have a third-party perspective on your own performance. This is our simulation lab, and this here is SimMark. He's a high-fidelity mannequin that's capable of responding to what you do and physically moving around. So here, you'll be given a scenario, like for instance, Mark could have a heart attack, and it's going to be up to you to determine the best way to treat him and potentially save his life. And while you're working on Mark, you're actually going to be observed behind a two-way mirror, where your instructor is going to be able to observe your performance and physically control how the mannequin is reacting to you. Now, this is our testing room. This is where you'll complete your standardized exams that are structured similarly to the NCLEX exam. You'll be completing it under the guidance of our testing coordinator, so that way we want to make sure you're as successful as possible. And this is our dedicated study room. Anytime the building is open, you can use this space to study either by yourself or with a group to make sure that you always have a safe and quiet place to study. And this is our skills lab. This is where you're going to be practicing the everyday skills you're going to be using as a registered nurse, from assessing the patient, inserting IVs, wound care. You'll receive one-on-one help from your instructor thanks to our small class sizes.
Lindsay, an Accelerated Bachelor of Science in Nursing student at Averett University, chose the 16-month ABSN program to earn a nursing degree in an accelerated time frame.
I'll be done in a very short amount of time. I'll have a degree and a certification that I can move to different states with.
Fast track your nursing career. Aaliyah Rivers found a supportive learning environment that could help her efficiently achieve her nursing goals through Averett University's 16-month ABSN program.
I did not want to go back to school for 4 years. Having this as an option was very appealing to me. I know it's going to be very rewarding at the end of it.
Aaliyah chose the path she knew was right for her, and you can too.
A nursing program from Averett University lets you earn your nursing degree in as few as 16 months. If you have prior college experience, our multiple start dates and rolling admissions process let you start nursing school sooner. There's no wait list, and you can apply if you have any bachelor's degree or at least 60 college credits in any field.
Averett University's Accelerated Bachelor of Science in Nursing program in Norfolk, Virginia lets you earn your nursing degree in as few as 16 months.
This program is very fast-paced, which means I'll be done in a very short amount of time.
Between essential prerequisites, professional instruction, and valuable clinical experiences, you'll be ready for diverse opportunities in nursing. Consider Averett as a fast track toward your future in nursing.
The Accelerated Bachelor of Science in Nursing program from Averett University lets you earn your nursing degree in as few as 16 months. We offer learning options to fit your busy life, and with 3 start dates every year, classes are always starting soon. There's no waitlist, and you can apply if you have any bachelor's degree or at least 60 college credits in any field.
Aaliyah, an ABSN student at Averett University, relied on a few keys to success as she went through her challenging yet rewarding nursing journey.
Remember why you want to be a nurse. Make sure you have a great support system to help you achieve your goal.
Her dream is to make a difference in people's lives, and she's achieving that every day. We believe you can too.
Hey everyone, welcome to Averett University. Here at our Norfolk site, we have our Accelerated Bachelor of Science in Nursing program, where a student can earn their Bachelor of Science in as little as 16 months. I'm excited to show you around. This is our student lounge. This is where our students are able to come relax, study in groups, and enjoy a nice lunch. And this is our debrief room.
Okay, welcome everybody to Averett University's Pathway to Nursing event. If that's not what you're here for, I'm amazed that you found this event. But no, I know you're all here for our Pathways to Nursing event, so thank you all for taking the time. My name is Jared Bishop. I am the Director of Recruitment here for our ABSN program, Accelerated Nursing, and want to take a moment here to introduce everyone who is not going to be speaking during the event, and those who will be speaking will introduce themselves. So first, I would like to introduce my office manager, Sandra Raker. my admissions advisor, Trevon Nimmo, and the academic success coach, Jeremy Bishop. And on the screen here, you can see we have our agenda. So now that we've had a chance to do some introductions, now we are going to do a little program overview of what to expect in the ABSN program. And how I like to think about it is to kind of divide it into 3 buckets: the online, the labs, and the clinicals. So for the entire 16 months of the Accelerated ABSN program, at the end of which you'll earn your bachelor's of nursing, which will entitle you to sit for that NCLEX exam. During that entire 16 months, you're going to have an online portion of your education. So that's completely asynchronous, so you're able to complete that coursework on your own time, as long as you're responsible for meeting deadlines that occur throughout the week. And what you're going to be doing is kind of reading material. You're going to be responding to discussion boards with your peers and your instructor. You're going to be writing papers. You're going to be watching videos. And most importantly, you're going to be completing online interactive activities that help to virtually walk you through some of the aspects of registered nursing. So that way we can make the most efficient use of your time once you step foot in the lab room. So speaking of that lab, during your first 8 weeks of the ABSN program, you're going to be spending the majority of your time in our skills lab. And the reason why is because we want to make sure that we're getting you ready to develop your skills before you start applying them with real people when you're out on your clinicals. So in that skills lab, we keep the student-teacher ratio small, so that's no greater than 12:1. So that way we can make sure that you're getting hands-on instruction during that skills lab. And what you're going to be doing in that is you're going to be working with mannequins, as well as doing things like practicing drawing blood, inserting IVs, wound care, patient checkoffs, things of that nature, so that we can make sure that you're prepared and safe when you're working with real people. And another thing that helps prepare you to work with real people is our simulation lab. So that's where you work with our high fidelity mannequins. And for those who attended in person today, you got to see a little demonstration of what that mannequin is capable of. But for those who don't know, it's able to respond to what you do. You can physically draw blood from it. It's capable of bleeding, yelling. We even have one that can go through the birthing process and give birth to a little baby mannequin. That one can get a little bit messy though, so we don't typically include that one on the demonstration. But the reason why we do that is so that way you can get comfortable with what a real person is going to throw at you, because it's being controlled by our mannequin technician. His name is Dino, so that way he can give you a variable experience. Maybe the patient is being a little bit combative, or maybe they're scared of needles like myself. They can prepare you for those things you're going to encounter in the real world. And speaking of that real world, we have your clinicals. So for your clinicals, that student-teacher ratio is no greater than 9:1. And what we do is we partner with clinical partners such as our lovely representatives from Bon Secours and Centera to help to make sure that we're giving you as wide a variety and as high quality clinicals as possible. So you're going to be completing clinicals in a variety of locations, such as Maryview Medical Center in Portsmouth, Centera Lee right across the street, Centera Norfolk General, as well as smaller places like long-term care facilities like Westminster Canterbury or Bickford Senior Living. So we can make sure that we're giving you a variety of experiences, everything from med-surg to labor and delivery, pediatrics, geriatrics, even a psychiatric rotation. So we can make sure that no matter what your long-term goal is, you're going to have that kind of footing in place, so that way you're able to pursue that and work to what your passion is. So I want to take a quick pause here and see, does anybody have any questions for me regarding some of the details about our ABSN program? Okay. Well, then next, I would like to share a little bit about the resources that you have during our ABSN program to help you to be successful. So the first that we have is use of our facility. So every day, Monday through Friday, except for federal holidays, 8 a.m. to 6 p.m., our site is open. So that way you can come in and study. I know that for many people, they're not comfortable studying at home, whether that be because it just helps to be in like a more work-oriented environment to study, or maybe you have young kids. We always want to make sure that we're offering a space that you can come in, so that way you can study distraction-free. And this room that we're in right now, when it's not being used for our Pathways to Nursing event, is actually our designated quiet study room. So that way people are able to come in, they know that they're not going to have any distractions, and get prepared for anything that's on their mind. In addition to that, we also have office hours for your instructors, both your online instructors and your lab instructors. So that way you're able to discuss any issues or questions you might be having regarding course material. But the best way to get some practice, especially on the lab material, is what we have called Open Lab. So every week, typically on Mondays, we have an open lab where students are able to come in and practice whatever it is they want. So if you want to spend 4 hours practicing inserting IVs or anything that you want to practice, you just let your instructor know, and then they're going to get the materials for you, and they will be there and help you and assist you while you are practicing doing that same thing for 4 hours, just to make 100% sure that you've got it. In addition to when we're talking about extra practice materials, we also utilize ATI study materials. So while you will have some required ATI work, ATI is also full of a ton of optional materials, from optional readings to practice tests that include reasonings regarding why a particular answer is right or wrong. And this is subdivided into different categories. So if you're not feeling maybe 100% as strong as you could be on a particular category, there's extra study resources there so it can help to make sure that you are going to feel 100%. And then what also will help you to feel 100% is group study sessions and tutoring. So as far as tutoring goes, it is free, and what we do is you're able to submit the topics that you want to be covered during that tutoring session. And then the tutor will be prepared to discuss those topics. They are all registered nurses that are those tutors. And it is small group. So typically around 4 to 5 students will attend those tutoring sessions at once. However, we don't have a limit on that. So if only one student happens to sign up for that tutoring session, then that tutoring session, that'll be one-on-one tutoring. Now, if nobody signs up, the tutor's not going to be there to teach to nobody, but as long as one person signs up, then they'll still be there. And then as far as group study sessions go, while we will never mandate that a student go into a study group, because we found that that isn't super successful for group building, we do everything we can to facilitate natural study groups forming, whether that be social events with your peers and different like cohort mixer events. So that way we can make sure that you're kind of building those bonds naturally and finding that study group, because what we found is that when students tend to study together, those are the ones who tend to be more successful. And then finally, we also have a pre-start nursing course they'll have access to before you even get started. And essentially what that is a course that teaches you how to be successful in nursing school. So that covers everything from how to read a nursing textbook, how to understand nursing questions, nursing answers, even things like time management, so that we can make sure that we're setting you up for success before day one even starts. Any questions for me regarding the resources that we have to help you to be successful? It's okay, I know you're holding all the questions for the end. So, well, then with that, I would like to pass it off to Bon Secours to be able to share some stuff about their organization. And so I'm just going to go ahead and start our slideshow here and then hand off the mic to Kai.
Hello, everyone. Good evening. My name is Kaisha Ware. You can call me Kai. I am the University Relations Specialist for Bon Secours, meaning all things that have to do with nursing student, upcoming grad, new to practice. That's where I come into play, okay? Awesome. So Bon Secours, we are the 5th largest Catholic healthcare system here in the U.S. and the largest not-for-profit private provider in Ireland. So did you guys know we were in Ireland? No? Yeah, so if you want to go across the pond, just let us know. You're able to do so. So here in the U.S., we have more than 1,200 sites of care, or between the U.S. and Ireland, 49 hospitals, 3,000 providers. You guys see the demographics here, but I do want to emphasize that we are along the East Coast. Okay. All right. So leading the way with integrity, human dignity, compassion, service, and stewardship. So these are our values. Okay. We extend the compassionate ministry of Jesus by improving the health and well-being of our communities and bring good help to those in need, especially people who are poor, dying, and underserved. So you guys heard me mention Jesus. You heard me mention us being a Catholic healthcare system. So it's needless to say we are a faith-based organization, but we accept patients and employees from all walks of life, okay? So that's really important to remember. Okay, so here in Hampton Roads, we have Mary Immaculate Hospital located in Newport News. Are you guys familiar with Mary Immaculate? Okay. Okay, a few of you are. Awesome. So Mary Immaculate, that is our magnet hospital, which means it has been recognized for its nursing practice and patient care, which is a really hard accomplishment to achieve. So we're really proud of Mary Immaculate at this time. It's also known for mother-baby, labor delivery, and NICU as well. Okay. And then Maryview Medical Center, which was mentioned earlier, where you guys will be completing some of your clinicals. That hospital is mainly known for its cardiac care, stroke care, behavioral health care. So if any of you guys are interested in those type of career fields or those specialties, this will be a great hospital to go to. It is also our largest hospital here in Hampton Roads. Okay. We also have Southampton Medical Center that's located in Franklin, Virginia. It has all the things: inpatient, outpatient, emergency. It has a long-term care facility attached to it. It's pretty much like the hospital for Franklin. Pretty much anyone who was born there in Franklin was probably born here at Southampton Medical Center. Okay. And then we also have Harborview Medical Center that's located in North Suffolk, which had its grand opening this month on the 8th. We were really excited about this grand opening. It is a full surgical center, so we are really, really proud of this hospital here, as we are with all of our hospitals here in Hampton Roads. Does anyone have any questions about our locations at this time? Okay, awesome. So student opportunities. I'm not going to read this to you guys because you guys can obviously see it, but I do want to point out that starting your foundation at a good hospital to get that clinical experience is pretty important. It gives you a feel of what the environment is like. And here at Bon Secours, you can start off with us even before you start your clinicals. And I'll get into that in the next slide. So if you start with Bon Secours, before you even start your clinicals, you can come on either as a care companion or a patient care tech trainee. You can do these positions before you are licensed, before you get any type of certification, pretty much as long as you have your high school diploma or GED. Okay? Now, while you are in school, you can advance to a patient care tech. So if you already have a certification like STNA, CNA, or you have completed at least one semester of clinicals, you can come on as a patient care tech. Okay? And moving on, you can also be a student nurse if you've completed at least one semester of clinicals as well. Okay? Now, during the summer, we have a great summer nurse externship program, which you can participate in as long as you have 1 year of school left. Okay? Any questions about that before I move on? Okay. So after you become licensed, you are considered a new to practice nurse. With Bon Secours, we have a great first year experience for all of our new grads, all of our new to practice nurses. And you guys will see me here at Averett often where I will give you all of the information about that first year experience, okay? And then after you have more than 1 year of experience as a new to practice nurse, the sky is the limit for you guys. And these ladies, I'm sure, will get into that shortly. All the many wonderful things you can do as an experienced nurse. Okay. So for our benefits here, I'll start with our well-being resources. We, of course, have health, vision, dental. We also have a really great mental health benefit as well. So we know you guys are entering a career field that can sometimes be hard on you mentally and emotionally. So we think it's really important to utilize that mental health benefit, okay? We also have a great health reimbursement account. You would actually have 3 options. You have the HSA, the FSA, and a reimbursement account as well, okay? Then we also have a great benefit. It's called Call to Shine. So this benefit is a way to keep up the rapport with everyone within the Bon Secours Mercy Healthcare system. So what this is, let's say you're on the floor, you're doing an amazing job. Your patients love you, your coworkers love you, your charge nurse loves you, everyone loves you. You get a shout out by one of your colleagues on Shine. They give you points. And let's say some of your other coworkers see, your charge nurse see, the manager sees, everyone who sees this shout out can also shout you out and add to your points. The more points you get, the bigger the prize. A lot of people use it for gift cards and things of that nature, but there are all type of things on Shine. You have patio furniture, you have accessories, electronics. So obviously the more points you earn, you can choose from anything that's on Shine. So this is a great way to just keep up the rapport with everyone. And then we also have the education benefit, which I'll get into next. Specifically for you guys who are pursuing your BSN, we will be able to pay 100% of your tuition. I didn't see enough happy faces when I said that. Nursing is a priority clinical pathway, so we will pay 100% of your tuition. And if you have any questions or want further details about that, I do have my business QR code at the end of this presentation, okay? And then to apply, of course, you can go on careers.bonsecours.com, but something that I like to do, if you and I connect one-on-one, you tell me where your goals are, you tell me what you're looking for, then I'll scour our career website for you. I'll find positions that aligns with what you're looking for, and I'll either text them or email them to you just to make things a little easier for you while you're in school, okay? And this is my business card here that I spoke of. Please feel free to scan it if you want to connect with me one-on-one later, especially if you want to discuss that 100% tuition benefit. And that is my time. Thank you, guys.
Awesome. Okay. Thank you. Thank you very much, Kai. How about a round of applause for Kai? Let me just go ahead and pull up a slide real fast here. Unfortunately, we have had a little bit of a change in our programming. I got a text from our Centera representative that there was an emergency on the floor. Relief was not there as expected, so she is currently handling that. However, I would like to speak a little bit about our Centera partner as well. Our 2 main partners, Bon Secours and Centera. So for Centera, the hospitals that we partner with in that network are Centera Lee Hospital, Centera Princess Anne, Centera Obacy, as well as Centera Norfolk General. And through that, you're able to get a wide variety of those rotations, whether that be labor and delivery, long-term care, med-surg, primarily what we use the Centera partnership for. And in terms of benefits of kind of doing clinicals at the Centera sites is while you're doing your clinicals, the kind of the hiring decision makers, they're able to directly observe your performance. So that way, when you do go to apply after you graduate, or in some cases even before you graduate when you're in your final semester, they already know who you are. So it makes that process very easy and very seamless. And then in terms of as far as tuition benefits, Centera has tuition assistance through the Guild program, as well as tuition repayment for those who graduate and then begin working at a Centera site. I will admit I am not 100% the expert on that. I am not a Centera employee, but for anyone who is interested, you have my email, so please reach out to me, and I'll make sure to share our contact information with you. Her name is Diane Rogier, so then that way she can connect you with those resources as well. I'm not sure how many questions I would be able to answer on the Centera side of things, but feel free to ask away. Okay, well then with that, I would like to turn it over to our panel of very accomplished nurses, or soon to be accomplished nurses. I will still stay here at the podium to help moderate and also field any questions as they are coming through. But with that, I would like to turn it over to you all to share your experience.
Do I get to go first because I'm sitting here? Yay! Hi guys, my name is Courtney Hine. I am a registered nurse. Talk to you guys a little bit about how I became a registered nurse and the things that I've been able to do with that degree. So it was a second career for me. My first career was not in nursing at all. I started off in the medical field and then went into more business and ended back up in the medical field. And I always thought I'll never be a nurse. They work incredibly hard. I'm going to be a doctor, right? And then I got into patient care and I realized that I wanted to be a part of holistic care. Like I wanted to have a hand in everything that was happening for that patient. My sister would call it control freak, but I just like to think big picture. And so as I started to explore what the options were within healthcare and what really fit my personality and what I wanted to do for my community, I decided nursing was it, because it gave me the opportunity to do a vast range of different jobs within the degree, but also it gave me an opportunity to have a hand in getting that patient through whatever we were getting through, whether that was an office visit in the physician's office, in the emergency room, holding your mother's hand, while your father is in hospice. I mean, it just allowed you to have such a grand view of everything and be able to be there for your patient and your family. So that's what drove me to nursing. I have my BSN. I did not get it at Averett, but I went emergency medicine immediately. I love, again, to be in control of a lot of things. I love critically thinking. I love fast-paced. I need to stay busy. And emergency medicine was it, and I knew that immediately. Did my clinicals, loved all of my clinicals, but was like, eye on the prize, I'm going to emergency medicine. And that is what I did. I was lucky enough to go into a preceptorship in nursing school and go directly into a level 1 trauma center in the area, and loved it. Was working nights, and then life hit, right? My husband's a firefighter. He works 24-hour shifts. We have 3 small children. And we were just talking, there's personality types. I'm a nights girl, I'm not a day shift girl. But kudos to all my day shift people. But my options just were limited. 12-hour shifts, having small children. I was coming home. I just felt like I was being pulled, giving a lot at work, giving a lot at home. And I had to make a decision on what I could do. I said, I need something Monday through Friday, more stable, so I can get my kids from daycare and things of that nature. And that's the flexibility of this degree. Number one, right? I didn't have to even think. I knew I'd be able to get a job. There was no stress. I knew that if I left the position I was in that I loved, I would find something to fill that gap. And I did immediately, and I went into private practice, outpatient surgery. And that drove me all the way up to be the administrator and the director of surgical services, which is, if you would have asked me when I was graduating nursing school if that's what my job would have been, I would have been like, no way. No way. So I tell you all this to say how I landed in my position now. I was ready to give back and be a part of something, I don't want to say bigger, but the future of nursing. I think healthcare is extremely difficult, and I wanted to inspire others and be more a part of that journey, from when you start nursing school all the way through that first year. And I was lucky enough to find a position with Bon Secours, and I am the manager of the Office of Academic Affairs. So I have the privilege of working with a ton of nurses in all of their wonderful clinical coordinators, directors of nursing. Veronica and I talk very often. And I will tell you that I do have my hand in a lot of schools in the area, and the Averett students are amazing. And I don't say this because I have to. I just say that when the feedback we get from the units is that this program is very supportive. The students that come through our clinical rotations are prepared. They are ready to jump in. They want to be there, and they're excited to be there. And all of that is so important, right? Because you want to get out as much as you can from your clinical experience. Number one, because I know Jared talked to a little bit about it, it's your interview, right? If you love that unit, but you're also interviewing the units, the hospital, the patient population, right? You're starting to figure out, and those things are moving in your mind. What do I want to do? What do I like? What did I think I wouldn't like? You know, so all those things are going. But I think Averett does such a fantastic job at preparing their students for that. There's a ton of support here, and I just say that a little sidebar. That's not my pathway to nursing, but just kudos to what they're able to do in such a fast-paced program, in really graduating prepared nurses that are excited to be a part of nursing, and they're ready to just hit the ground running. And so kudos to you guys, because you're doing good work here. But yeah, I think the key takeaway for me is that, you know, nursing is going to be what you make of it. We all hear about healthcare being difficult, and it is. But you focus on the wins, right? And this degree, like I said, can go anywhere. It is the most versatile degree when you think about bachelor's degrees. You could never touch a patient. You could go into legal nursing. You could go into chart audit nursing. You can go into informatics. You can be bedside. You can go into leadership. You can go into education, all with one degree. So it's just having a passion of wanting to be involved in healthcare and then deciding where that road is going to take you. So I say it all the time. It's the best decision I ever made. It's not where I thought I would be, which is just, you know, that's life, right? But you're taking the first step, and I can say that this degree can take you wherever you want it to go. So I guess any questions? All right, I'll pass it off to Veronica.
Hello, good evening. My name is Veronica Ziegler. I am the director of, can you hear me? I'm the director of nursing here at Averett. What I do is pretty much everything, but I partner, I go out and look for, I network and look for clinical opportunities, and I, work a lot closely with our clinical partners. A little background about me, I always knew, since I was a little kid, I always knew that health sciences was my jam. I always excelled in anatomy, and so I started as a dental assistant. So in high school, I went to Votech and started as a dental assistant. And then I enjoyed it. However, it's like repetitive for me, and I just wanted to do something more. So I went to school to be a medical assistant and loved it. Again, I just I want to do something more, because I was limited to what I was doing. So, and then from there, I was like, okay, what do I want to do in life? So I thought about respiratory therapy. I was like, no. And then finally I said, you know what, let's go for nurse. I want to do nursing. And nursing for me is more of a calling, because I've always want to help serve. Like, that's the biggest thing for me, is servitude and serve the community. And so it took me like 5 years for my degree because I did the traditional. But you know, I wouldn't have changed that. I think with this program, I mean, you'd be done in 4 semesters. Mine took me like 4 to 5 years. I minored in business. And so when I graduated, I went straight to postpartum. So I've worked mother baby. And but before that, I did an externship during the summer because I really didn't know what I wanted to do. So I did an externship, and they assigned us to different units. So I've tried OR, I've tried diabetes, mother baby, and so I chose mother baby because more so because of the team, you know, because when I was there, I mean, I enjoyed, you know, the moms and the babies. That was a great experience, but also just observing how the nurses were working as a team, you know, and that's something you may want to think about, you know, are they a team? Are they working together? You know, because not only that they're interviewing you, you're interviewing, like, you're observing them. So from there, that's working in mother baby. That's when I thought. That's when I discovered that teaching is my next passion. Because at first I wanted to be a nurse practitioner, and then, you know, that's not what God wanted me to do. He's like, I got another plan for you. My manager just say, hey, you know, he gave me a packet and said, I think teaching will be great for you. Because I was the one, you know, students will come on the floor, and, you know, I was like, come on, you know, like, put them under my wing, and, you know, and just teaching the new parents, you know, especially the new moms and dads, you know, like how to change a diaper, and just, I don't know, just seeing that aha moment, you know, and the students like eager to learn. I was like, you know what? I think this is my jam. I think I want to teach. And then also you get, you know, as an educator, you do online classes. I'm a single parent of 3 girls, so it was easier to work nights and take my classes online. So that's a big thing here. You get to work and, you know, work on your own pace. So that helped me a lot. And so I got my master's in education. And then from there, I've taught OB. I've taught many different courses, and started working here 3 years ago. And I enjoy working here because we're a family here, and one thing for sure, you know, you could get to me very easily. Some places you go, it's hard to even find the director of nursing. Sometimes I didn't even know who my director of nursing was. So, and you know, Jared is very supportive. I mean, he's like right next door to me. And so we are very invested. You know, we do really want you all to excel. It's a very fast-paced program. It's hard, but you got the support here. Even the online instructors, they're reachable. You know, I mean, you have to reach out to them, you know, because, but when you do, they're accessible. They offer, that's another thing that's very impressive to me, that they offer reviews. You know, reviews before tests and reviews to see what you got wrong on your test. I would say there's not many programs do that. And I was very impressed about that because not many programs do that, and we do. And the simulation is amazing. I mean, we could make that sim man seize. His tongue could swell up. It was pretty interesting. I mean, it swole up. And I was like, so we be having fun in there. And it's like it's a learning, you know, we're here to learn. I believe in having fun when you're learning, because that's when your endorphins kick in, and when you're happy and when you're having fun, that's when you learn, and that's what we do here. So simulation is a learning experience. We're not here to like, oh, you did this wrong. It's like, okay, let's talk about this, you know. And I don't know about you, but I didn't have a simulation lab. We were like practicing on oranges and hot dogs. I don't know. The hot dog was a sub-Q. Like, that's when we did the sub-Q. And then the oranges, we did the IM shots. And I'm like, man, you got a whole arm here that could bleed, you know? So, I mean, we got some neat stuff here. And, so I will really enjoy to have y'all here. I think it's a challenge. Anything in life, that we really want, it's not meant to be easy. You have to work hard for it, because then you won't appreciate. So you work hard for it, but we're here. And, as far as clinicals, Bon Secours have been amazing, in Centera as well. I work very closely with Courtney. I call her on the phone, and she helps me, helps the students get through the onboarding process. And Kai's always, she's over here. I mean, y'all be getting some free lunches sometimes at clinical, like some good food too. So she'll hook you up. And then we have a new success coach. He started this week, and so we have a great team here, and hopefully I get to see you around. And another thing is, if you need, I got a box of tissues, so if you need to come to my office and say, let's talk, I'm like, okay, you could, because I don't know about you, I've cried a few times, and I've learned more than more, and just having someone to say, hey, you can do it, it's okay, just take a deep breath. You could do this. I mean, I'm more than welcome to have my door open. It's literally right by the lounge. Like you could go through the, sometimes I'll be, hurry up, open the door, and you're like, Missy. So like literally you can see me through. So, well, welcome. And I'm going to pass the mic to Adrian. Oh.
Thank you. So my name is Ariane Loxton. And I actually graduated from Averett. I think I was cohort 4. I want to say it was 4. And I am currently working at Maryview's ER, and I love it. So I didn't initially think I would be in nursing at all, but I knew I wanted to be in healthcare. I was a scribe in a level 2 trauma hospital before, and I loved it. Like, I saw a bunch of in our area, it was a lot of farmland, but also we were relatively close to DC in '95, so we got all those car accidents, and we got the occasional tractor accident too, because farm. Yes, wasn't great, but I saw a heck of a lot. I learned a heck of a lot, and I was thinking, oh, maybe I want to do be a provider, MD, DO, maybe PA or NP. And I loved learning from all the providers. They were so willing to teach. Yeah, this is heart failure. This is what you expect. These are the drugs that you expect these patients to take. And I, as a scribe, I wrote the HPI, so history of present illness, meaning the reason why the patient's there, essentially. So being familiar with diagnoses, being familiar with medications, those are the skills I learned. And I really liked working with the NPs because they were so, I wouldn't say that the MDs or DOs were any less, but I loved the interactions between the NPs and the patients because they took everything of what the patient said. It's not that, oh, I'm here for chest pain and I'll just do a chest pain workup. It's oh, what do you do for a living? Do you smoke? Do you drink? All that. Is there anyone around you sick? They try to get a whole picture to see, is there something in your life that's causing your problems? And can we fix that so you don't have to come back again? It's that kind of thing. And I really appreciated that. So I talked to the NPs and they're you get your RN first, get a few years under your belt, and then get your NP. So that's what I decided to do. So I chose Averett, and I moved here from Fredericksburg. It wasn't too bad of a move, and I love the program. So I liked how fast-paced it was, because if it was any slower, I think I would fall asleep, honestly. And I loved our group. We just automatically went to study groups, and we either decided to stay here and stay until the facility closed, or I went to a Starbucks, we went to Stella's, and we studied there and did our homework, and it was great. And I could definitely see what we learned in theory in the classes and use it in clinicals. Like, I had a patient that had pretty much everything we went through in our cardiac unit, and it was like, okay, I got it down, and I got a 99% on that test. I was like, okay, cool, it's great. And then once I decided to actually choose Bon Secours, I went through the ACE program, and this is a new grad program that you can choose, and you can go through all the different units. You just tell them like, hey, I want to go to ER, and they're like, okay, you can go to ER when you go through. Pretty much taste every unit, but let's do ICU, let's put in step down, let's do pre-op, so you get a sense of like what these patients are going through, maybe either before or after they go through the ER. And I built up my skills a little at the time, so I understand what med-surg nurses are going through, what pre-op nurses are going through, and ultimately I did again choose ER, but like I appreciated what a patient would experience in our hospital, and I loved it. And I chose night shift because I love them. It's such a good group. And even if we're really inundated with very sick patients, like I trust my group. And we get through the night, we clean up, patients are clean, safe, and they're where they need to be. And I love it. And I just came off a night shift last night. And it was tough, but we got through it, and everyone's safe. So I would definitely choose this program again. I loved it. And if you have any questions about being in the ER in Bon Secours, I'm here.
Thank you. Hey everyone, thanks for coming tonight. My name is Riley Steinbrenner. I am a first semester student. So I just started 3 weeks ago on May 5th. So a little bit about me. Unlike these lovely ladies, I did not want anything to do with healthcare in college. I wanted to be a journalism. I wanted to go into journalism, which I did get my degree in. I went to school in Wisconsin, graduated in 2017. And what I wanted to do was be a medical science writer, and you have to have a degree in the sciences, really, or experience to do that, which I did not have. So I eventually found my way into the Coast Guard because my dad was military. I grew up here, so he's in the Navy, and I call this home. And so went to Officer Candidate School, did all that jazz, and was in New Orleans for 3 years as a search and rescue operations officer, doing coordination. So nothing like in the field on a boat or anything, but I really enjoyed helping people and like being on the 12-hour shifts. Like I love night shift too. And so I really love that fast-paced environment, but a part of me always wanted to like actually be helping people one-on-one. Because I always got to talk with the rescue swimmers and the flight surgeon. I'm like, man, I wish I could be there on scene, like actually helping people. So I knew I didn't want to make the Coast Guard a career, so I got out after 3 years. So November of 2023. And that's when I really started to think about what I wanted to, do with my life. So I wanted to use my GI Bill. And that's when I started looking into nursing programs. I considered other career paths, but when I was like, you know what, this is what I want to do is help people one-on-one, and nursing is the best fit for me. So then I reached out to Averett, like you guys probably filled out the form, to get information, and Amani reached out to me. So I began that process March of last year. And so like I said, I did have a BS, but I didn't have any like anatomy or microbiome. So I did all of my prereqs through Averett online. So if anyone like needs any of those or like have questions about that process, like let me know. So I had to take 4: anatomy 1 and 2, microbiome, and developmental psych. And that whole process, so I started those in April, finished in December, this past December. And honestly, like the workload, we could talk more about that if y'all have questions about it, but the workload was like really not that bad, and I was working full time like at the same time. So it really was not bad. And then like I'd said, I just started in May, and it really hasn't been terrible, knock on wood. But we had our first exam on Monday, and that went well. Like Jared said, forming your study groups, like I'll just say like Averett has been just great in helping us like form communities from the very beginning. Like we had a student orientation over Zoom, and then like that enabled us to like form a little group me and get to know each other. So it's definitely like the experience is what you make it. They give you opportunities and resources to create those communities. But you're responsible for like putting the effort in and actually like making those connections and making friends. And the professors here are great, like Professor Wilson, Professor Cooper, and I mean, you'll meet them all when y'all start. But like I had lab today, so I have lab Tuesday, Thursday, 8 a.m. to 4 p.m., not 9. So like typical like 6 or 7 hours. You get an hour for lunch, so that's nice, a little brain break. But yeah, the professors are very great one-on-one. Class size is really small, like Jared said. I think there's like probably like, I don't know, definitely less than like 15 or less than 15 in my class. And yeah, like very fast paced from the very beginning. Like we did wound care today and it was so fun. Like, and like, I mean, and that's just week 3, right? So you're going to be able to like get your hands-on experience right away. And, yeah, I'm loving it so far, and I feel like I will enjoy it even more once clinicals start. But if y'all have any questions about, like, I know you're kind of in the, you know, or I guess, you know, pre-orientation phase, like doing any prereqs that you need, I can definitely help answer those questions as well as give you some insight of what, like, your first few weeks are like. So nice to meet you all, and hopefully you have some questions for us today. Thank you.
Before we get to those questions, how about we just give our panel a quick round of applause here? What are those amazing stories? Wow. And now, would like to turn it over to see if you have a question for the panel. You know, please feel free, if you're in person, you know, raise your hand and ask, or if we have any questions from online, this will be communicated to me so that way I can communicate them to the panel here. So I'm sorry, I just want to paraphrase real quickly so my people online can hear the question. Essentially, how to balance nursing school when you're working, you have kids, and how that balancing act goes.
I'll give my 2 cents, and then you guys can share too. I think anything's overwhelming when you think about it like that, right? When you actually put something to paper and you say, how am I getting from point A to point B? It can be very overwhelming, especially when there's a lot of extenuating circumstances that maybe aren't in your control necessarily, right? Like you have bills to pay, you have children to raise, you have a family. And I think the thing is to make the decision, right? I'm ready. So that's the first thing, because that's the hardest part, right? The hardest part is committing to something new, something scary, and something very time consuming. I always tell my kids this: the time is passing no matter what, right? Oh, this is going to take me 2 years. The 2 years is going no matter what you do with that 2 years. So if you have a goal and you're sticking to it, you're going to get there, right? Sometimes the path takes longer, sometimes it doesn't, right? So I think anything is doable. And another thing that I live by too is action expresses priority. We make time for what we want to make time for. And that's just anything that we do. You know, it's like, oh, I didn't have time to go to the gym. Well, because I prioritized something else. And that's okay. But I think when we're honest with ourselves, we make time for the things that are important to us. And I think when you enter a program like this and you have a passion for healthcare and you have a passion for nursing, you make it work. Is there sacrifice along the way? Absolutely. I had a 6-week-old son when I started my nursing program. It was accelerated in the fact that I did my first 2 years at a community college, and then I did my nursing through this program. And it was didactic as well as online. So it's very similar. And this is like when online nursing programs were kind of just getting started. So it was like chaos. And I got a call and they said, hey, you're coming off the wait list and you need to do all these things in the next 3 days and you start in 2 weeks. And I was literally holding my 4-week-old baby and I was like, I'll be there. Done. And I hung up the phone and I looked at my husband and I was like, it's about to get rough. And he just changed his career from being a contractor to joining the fire department. It was going through fire school. And we had 3 children, all less than 2 years apart. I say all of that to say, if you have support, and sometimes that means yourself, a good friend, your kids, your family, everyone's support system looks completely different. But if you have the support and you believe in yourself, you will accomplish it. Right? Maybe it's 16 months like it's supposed to be, maybe it's not, and all of that is okay. Where there's a will, there's a way, and it will be overwhelming. But when you look back on it, and I say this to myself sometimes, because my sister will say, how did you guys survive? And I'm like, I don't know. Like, you have to just laugh, and you're like, we just did. And you look back and you're just incredibly proud for what you accomplished, what you showed your children you're capable of doing. You can do hard things, all of us, whether you're 4 years old or you're 40 years old, you can do hard things. And I think if you want to do it, you will, and you'll be successful.
Focus on your why. Definitely focus on your why. My daughters were around the same. I think they were like 5 and 3. And just know that you are a great mom, and it's okay to give them waffle, little frozen waffles or whatever, because they're eating, and you got there's been times that while they're in the what I used to do, go to McDonald's while they're playing in the park, I'm studying, or I find every moment, like, if I'm in the bathroom hiding, studying, there've been times that I'm like, well, I can't do this. And then I'm like, wait a minute, get out of my head. Why am I doing this? And this is to build a future for my kids, So there've been times my husband would be like, well, we're gonna go hang out with our friends and play spades. I'm sorry, I'm here studying, Or they might be, a graduation and I have a huge final, I'll go, but I gotta go back and study, or, like, it's the sacrifice. But you'll make time, and then, you'll have that support system. Also, don't be prideful, like, accept that help, definitely accept the help, make a community, because even some people in your own cohort will help you. Like, okay, you have clinical Friday, well, I could help you with your kids. Y'all could get together, have a potluck, have the kids play together. There's so many things. I know at the time, my ex-husband was in the Navy, so I didn't really have much of a, my family is in Puerto Rico, so my support was when I lived in military housing, I made friends with my neighbors and stuff, and I was so focused when he was out to sea. I used to go to the little meetings that they would have to see where they were at. I said, I just want to know where they're going, where they're coming back. I didn't really hang around to gossip or anything. I was so laser focused, it was ridiculous, because I know that degree is going to take me somewhere. And so, my daughters, for a little bit, they were like, Mom, we didn't do this, or we didn't go here. But then when they saw me graduate, they were so proud of me, and they're like, Mom, I'm so proud of you. But of course, they may complain a little bit because they want to do stuff. I'm like, I got to study, y'all. I got to study. But then now we're living in a nice community. They're I'm able to provide those things. But, you just got to hang in there. Just, you're going to cry. You may want to throw your books here and there, but you pick it back up and say, okay, brush it off and keep it moving. But your why, you have to go back to your why, and that why is going to push you through. So you're a great mother. Don't think sometimes you're like, oh, I didn't do this and I do that. Well, just focus while you're doing what you're doing. The kids will be all right. Those frozen waffles, they like that stuff. I'm very lucky. They're good. My husband's yeah. So. I mean, if you got to cook something quick, breakfast for dinner was a big hit. Yeah. So.
I will say I do recall 2 of my classmates, I think it was 3rd semester, gave birth, and they still got through. So yes, for sure, you can definitely make it. I remember there was another guy, he worked at the shipyard full-time, night shift, and he got through. So you can definitely do it. There's a person on my unit, she just got released full-time, and she said she got 6 kids, and she got through nursing school. So it's like, yeah, you can definitely make it. For sure, it is absolutely possible. But I will say, like they said, like you definitely need a good like support system. Whether it's us, because I remember a bunch of us were like, "Hey, you got kids, we got kids. They're about the same age. Like, we need to get together so we can both watch them, like she said, and still study." So everyone's taken care of. So like once you get here, make friends. Say like, "Hey, this is." What I got, this is my schedule, like, can we kind of work something? So, yeah, I would absolutely say it is possible, for sure.
And I'll add that too. I don't have kids, but like major kudos to all the moms who do it. Like there's at least one mom in my cohort as well, and like I think she just had like surgery, like Achilles tendon surgery or something like that, and yeah, so she's got a full plate as well. But for like a cohort as a whole, like you're gonna be doing something very difficult together, and we're all here for each other. Like, and I see that after just 3 weeks, where like you may not have a ton of time, like hands tied behind your backs as mom, and then like the people who do have like maybe a little more time, like I personally work part-time, so I don't have a ton free time, like compared to the people who like don't have kids, and again, like I don't have kids, so I'm again not as busy, but I feel like we all like make up for like time that we do or don't have, where we help each other out. Like we all are in a group meeting, we answer each other's questions, like nobody's gonna get left behind because we are a team, and like we help each other with like assignments and stuff, like assignments we're able to help each other on, and yeah, so I think every cohort does have like moms, dads, because that's how the program is designed. It's designed for those a second career. So I definitely wouldn't let that shy you away. And I was a kid who grew up on waffles and McDonald's, because my dad was underway a lot, and my mom was like a stay-at-home mom, and like she's juggling a bunch of stuff for us too. So I mean, I started from a very like we lived in a very small home, and like by the time my dad retired, like we were in a really nice community, and I hope, like speaking for your kids, like I don't remember my parents like the struggles that they went through, and I'm sure that they had their own struggles, but like from the kids' perspective, growing up, like I only remember like being proud of my dad like when he retired and stuff, and like seeing their accomplishments and stuff. So like I definitely wouldn't let that like shy you away from the program.
Okay, thank you to the panel for that question. Before we field our next question, a quick reminder, I apologize, I forgot. For my people who are attending online, please put your first name and your last initial in the chat for us. That way when you come in for a tour, we're gonna be able to give you a nice Averett water bottle, which also for all of our in-person attendees, you'll also be getting one of those as well. And also, please make sure that you're asking any questions that you have for our nursing panel in the chat. Because we want to make sure that we're getting your questions as well. And so with that, I will turn it on over for next question.
You guys are a quiet group. I know. You got it all figured out. I love it. You're ready to sign up. Ready to do it.
Well,
I do have a question. Just in general, for people who haven't experienced healthcare, haven't been at the bedside, going into nursing can seem intimidating, because all of a sudden it's not only bedside, but it's also like taking care of the pushing meds, everything else. So what would you guys say in regards to someone with no healthcare background who's wanting to just try to go into it off the bat?
so our question for the panel is basically, what advice do you have for someone who doesn't have any previous healthcare experience? Before I turn that question over, I do want to share. About greater than half of our students have no previous healthcare experience. But with that, I'll turn it over to the panel.
So the other thing that's pretty cool about this career is that you're always learning. So you may know nothing. You may know 20% of what you're doing that day. You may know 75%, something new comes along, a new piece of technology, a new medication. Everyone in healthcare is always learning. And so I think the most important thing to remember is that you want to find where you end up. You want to feel supported, right? You want to have a questioning attitude, and you want to be able to ask questions. The most dangerous thing for any of us at any point is to assume we know everything and not be comfortable asking a question. And so that starts from day one when you start nursing school. There's no silly question. If you don't understand a concept, I can guarantee you other people in your class do not understand that concept. And it's just a matter of something need to be presented a different way. So always ask your questions. I think there's so much collaboration within healthcare, right? There's so many facets and so many people and service lines that come together in order to make a patient have a successful outcome, whatever that may be, that we're just used to having questions asked. Like, it's like almost second nature. You don't expect anyone to know anything. And I think the expectations going in, like if I were to be working beside someone that I've never worked with before, let's say in the ER, and a travel nurse is there, I'm going to assume that person knows nothing and needs everything. So anything they come to me with, I'm ready to help, right? Because I too was in that position one time where I walked in that door and I knew nothing and needed everything. And I was still responsible for taking care of patients, right? And so I think just be confident in your lack of knowledge and be comfortable asking questions. When you get out of that space is when you become dangerous, because you're scared to admit an error. And again, that goes back to just patient care. But it's a much safer space than you assume because we're all learning. I think we all, I know the cool term now is like imposter syndrome. I wish I knew that existed before because I think I've lived many years with imposter syndrome. But it's like we all feel that. We all come across, I'd been a nurse for a long time and I had to ask about an LVAD and I was just like, this is probably something I know, but I hadn't taken care of an LVAD patient in like 5 years. Like, okay. So I had to pull another nurse in there and it was like, oh yeah, let me show you that. I just had an LVAD patient 2 days ago. I'm like, perfect. So we're learning together. And she's like, I only know this because so-and-so told me because I hadn't had, and we ended up, so it's less intimidating than you assume. I just think be comfortable asking the questions. And if someone doesn't want to help you, there's someone around the corner that will.
Piggybacking from what she's saying, hospitals have policies, so get in the habit of pulling up a policy. That's going to help you a lot. So for me, as a new nurse, I'm like, okay, even if you just got out of nursing school, I'm like, okay, so what is Bon Secours policy on inserting a Foley catheter? Because it will give you a step-by-step on how to do that. But the good thing about coming fresh with no medical knowledge, that you are learning the ivory tower of nursing. You're learning the NCLEX, and you're not how I say tainted, like you are learning, you're going to see some things, that is not, what do you say, Virginia Board of Nursing, like you're going to see some shortcuts and stuff everywhere you go. But because you're brand new and you didn't learn that, you're learning like the what you need to know to pass the NCLEX. So that you have one up on the corpsmen and the LPNs and whatever, because they already been out there, and they, especially like military corpsmen, I've noticed that they've done some stuff that wasn't within their scope of practice in the military, but then when they retire and they go to nursing, they still have those, and I'm like, you need to not just don't know. You want to, no, like that Kevin Hart, no, don't do that. So, don't, so that's a up for you. Like if you have no medical, like you learning what you need to know. And then also, like she said, it's scary when someone say, oh, I know everything, because no, you don't know everything. And that's, you could actually hurt or kill a patient that way. So my takeaway is, you're always gonna, if you have a team, pick your team. If you have any questions, we're here to help you in the hospital, and also look up your policies. Make that a habit, because you want to make sure you follow the policy. But here you have the sim lab, so you get to at least touch the mannequin, or you have skills lab. We do a long-term care facility, so that first clinical It's basically getting comfortable with patients and, learning how to do your assessment and vital signs. So it's okay. It's like anything you do, and once you get used to it, it's like second nature. But, fun fact, I still get my nerves. Even as I've been a nurse for a while, I don't know what it is, but I still get a little nervous when I'm on the floor. Even though I've been on the floor for 3 days in a row, I don't know what it is, but you're gonna be okay.
Yeah, I remember one of my classmates, she was an air traffic controller. And she was like one of our best students. Like you can definitely make it work for sure. And then someone else I think she was in advertising. And she was one of our best students too. So I would definitely say I would agree. Like you're a blank slate, and the nice thing about not being in healthcare, like in the background of healthcare, is that you understand from someone that you could essentially be in the shoes of the patient. So unfortunately, a lot of people become jaded when they're in healthcare for a long period of time, and they kind of forget to treat the patient, not just treat the disease or XYZ like that. So honestly, yeah, I think you're lucky, personally, because there's a lot of stuff when I was, I have a background as a scribe. I knew medications, so I could help people in class about medications, but there's just the way I was thinking wasn't quite what nursing school needed me to do. So initially I was like, I didn't understand why the answers were correct for nursing school. So I had to reset my mind in order to actually get through these classes. So yeah, absolutely. I think you can do it for sure.
I have the conch now. Okay. Well, first of all, what's your background?
Oh, I work in the ICU.
Okay, so you do have a medical. Oh, okay.
Just in general for other people.
Oh, sure. For the people online. She works in the ICU, by the way. Blank slate. And honestly, as long as you have that spirit of inquiry they tell us about in the first 3 weeks of nursing school, honestly, you'll be just fine. And I have not started clinicals or anything, but I'm speaking on my previous life experiences. I mean, I'm only 28, but in the Coast Guard, we were in training, and then when you're on the floor, you're on shift, you're oh, crap can hit the fan right now, and people's lives are at stake, But as long as you stay on your toes, approach things with care and compassion and genuine interest in wanting to help people and asking the right questions. And again, there's no checklist of right or wrong questions to ask, but as long as you genuinely treat everything okay, what's going on? Why is this happening? Yada, yada, wanting to approach things as getting to the bottom of something and not becoming complacent and not becoming okay, oh, you're experiencing XYZ, oh, you're going to be fine. But actually treating every patient with care, I think that'll be extremely that's how I'm going to approach it. And again, I have not started clinicals, have not stepped in a hospital in that capacity. But I know that I will be fine if I have that, spirit of inquiry about everything and treat everything seriously, but also, not too seriously, treating patients as humans as they are, and not textbooks or anything. So, yeah. Thank you.
Okay, awesome. Who else has a question for the panel? I actually have a question. What would you say is the most difficult thing facing the nursing field right now?
I think that's really complex, actually. I think shortage of nurses, number one, right? And burnout, number two, which is leading to the shortage of nurses. I think that's just healthcare wide. I think taking care of patients is incredibly difficult. I mean, giving a piece of yourself to other human beings is hard, right? Especially when you're trying to absorb their really bad day. I think someone else said it. It's an ER mentality. This is their worst day, right? We're seeing our patients on our worst day, and we try to keep that in the back of our minds because we're not always our best selves on our worst day, right? So when your patients aren't always the best to you, you try to remember why. I think nursing shortage, number one. I think there's a shift in healthcare. I think there's just a generational shift in general happening where the newer generation of, I would say, 20 plus going into the workforce have a different mindset than maybe previous. And all those things are good because that's when sites change within the workforce, right? But I think there is difficulty in getting people to maintain this career long term because it is so hard. So you have to have a passion, right? Because if you don't have a passion for what you're doing and wanting to help people, you won't last, right? You have to just, I don't want to say like, love your job, because not everyone loves their job and they can be successful, but you do have to want to help people and be willing to sacrifice a little bit of yourself in those interactions, just human to human. And then burnout. So I think taking better care of ourselves as nurses is really important. And I think there's been such a shift, I think just since post-COVID, as traumatic as that was for the healthcare world and healthcare employees, it did make us all sit down and really take a look at how we were taking care of ourselves and taking care of each other and parts of our team and things like that. And so I think just remembering that you can't lose yourself so much in it. You've got to stay focused. You've got to keep yourself healthy, just like in anything, or otherwise you're not going to be able to be successful in taking care of your patients or wherever this career were to lead you. So I think that's our biggest thing right now is we need lots of nurses, because this generation there's a lot of geriatrics coming in, and I need good nurses taking care of me in the not too distant future.
Definitely burnout. So for me, because I love nursing and the compassion, the servitude, that mindset that even on the toughest days, even the days that, we had like in Mother Baby, they're good days, but they're days where it could get turned left. And just having that team and that family, like we're hugging each other and supporting each other, and just making the bad days, even if it's a bad day, I don't hate my job. Like it's a rough day and a stressful day, but loving what I do is what makes it worth it. And even what I do now, I have those days too, but just seeing the students, progress and, and just being part of the community is what makes me push harder. So just finding, loving what you do and having that passion and that want to serve, is what's going to help you. But find time for yourself, sleep, eat, go work out, go to the movies, go watch, do something, a self-care, and know what your boundaries are. So you got to take care of you. It's okay to say no. If you can't pick up a shift, it's okay, really, because if you burn out, then so put the oxygen on you first, so you could take care of other people. You know what I mean? Because sometimes you're like, I got to do this, and then you burn yourself out, and then what? So, again, you got to love what you do and think about why you want to become a nurse. The money is great, but that shouldn't be the only motivator.
I probably would agree that, it would have to be burnout. Because I just worked 5 shifts in a row, and it was a lot. However,
you get that big break now.
Yes, I am off for a week, and I'm not touching my phone. I'm not going to pick up. But the nice thing is I have a team that's very supportive. Our night shift has a lot of seniority, which is fantastic. So the nurses understand burnout. So when I had a patient who was incredibly sick, like it was 1-to-1. I cannot leave this room. This patient will probably die if I left this room. My charge nurse was great in that she sent in a tech to help me out, and she covered my other patients, and we got through the shift. But that was only day 1 of 5. So after that, I had another intubated patient literally like 2 nights in a row. And it was a lot. However, again, team is great. We balanced everything. Like, people swarmed and helped me out. Everything was good. Patients in ICU, we fine. But still, like, I'm going from an intubated patient, we did CPR, all that, and next I'm putting in an NG tube, I'm putting in a Foley, I'm going to the next patient. It's like, at some point, if you don't take a break, like, yeah, you're gonna burn out. You might make a mistake that you do not want to make. Like, when we, as in the ED, give report to the nurses upstairs, like, sometimes they get snippy because they're burnt out too. They have like 8 patients. We have 4, but like, it's a toss-up of criticality, like how critical these patients are. So sometimes they won't take report because they have something else to do, or yes, again, they get snippy, but that's, you know, another sign of burnout. I give them grace. I work with them. This is what we do, so we don't all get burnt out. So I would definitely say we mitigate it by trying to work together as a team. But like, you as the nurse, like, yes, take your break. I'm taking my break. I'm a week off. I'm going to Busch Gardens. I'm going to chill. I'm going to run. I'll be fine.
I can't speak on the burnout piece yet, but I believe that. I would say another big thing facing the healthcare industry is having genuinely like compassionate healthcare like providers, nurses, like literally anybody in healthcare, because I feel like social media has kind of swarmed us with nursing as a career, and so people may get into it for the wrong reasons, like money. Like, I know people are like, oh, travel nurses make so much money, but you know, they're taking care of people every day on their worst day of their life, and like, people just like kind of forget about that. So I would say, yeah, I think that's one of the biggest things facing the industry, just like any career, is like the people who get into it for the wrong reason. So just like being mindful of that, I think will help tackle that. So yeah.
I'll just say this too really quickly. Obviously there's a lot to do in nursing, and you can be very successful, and you can make a lot of money, and you can have wonderful schedules, and you can have these days off, and you don't have to use your PTO, and all those things are great. But like we spoke about a little bit, it's just like any other career, like fire service, military, police. Like, it is a job of servitude. And if you don't want to serve, you will not survive. Because the first time a patient's family throws something at you, and none of this should happen, right? We all understand that these are things that should not happen in our society, but they happen every day, all day. And if you are someone who cannot get past, again, having compassion for someone's situation, and I don't mean being complicit or accepting, but I mean understanding that those types of environments come with the job, you won't survive, because there is so much that we cannot mitigate, that just comes with the career that we did not sign up for. So I think, again, just remembering, like, you know, there's some jobs that I don't want to say are thankless, but can feel thankless. And so you can't be in it for external validation or external gratitude, because it is few and far between, especially if you go into critical care. You know, if you're in the ICU, these families are grieving. These families are not, they're barely surviving themselves. They have a very sick family member. The last thing they're concerned is about your feelings or how you are. And some people manage that better than others. But as the nurse, you have to be able to come in and you have to turn off your emotional response to other people's emotional response, not your emotions, right? Because we want to stay compassionate. But you have to be able to separate yourself personally from the environment that you're in and stay focused on taking care of your patients, and remember that you are here to serve your community, your patient population, or whatever your, you know, your service is for, because it is acts of service, with small thank yous, but when the thank yous come, they're very impactful, and you'll have patients that will impact the way you approach life or things that you think about for the rest of your life. I do promise you that.
Thank you all for answering that question. It looks like we have a question from our online participants. So the question for those who didn't hear is there's some concerns about rising violence towards nurses. What are your thoughts regarding those concerns?
So, and I'm sure my fellow ER nurse and probably ICU here as well. I mean, I know it happens everywhere. There's, like I said, unfortunately, there's violence against healthcare workers everywhere. And I'll say, firstfold, you can't go into your job every day thinking about that. I don't say we don't think about it, but you can't go into your job fearful. You can't go into your shift fearful. So it is an unfortunate aspect of nursing, and especially in the ER. We have a lot of patients in psychosis. We have a lot of patients under the influence. We have a lot of patients that have extremely traumatic events that have happened. Our ER has gone on lockdown plenty of times because someone has been shot, or there's been gang violence, or there's a child that has just had a trauma, and there's a lot going on, and people don't always manage their emotions very well, and especially in extreme circumstances. I do think the steps towards protecting our healthcare workers is getting better. Again, I think that's a lot to do with social media, which is kind of crazy. But the more that it's out there for the general population to almost see, it's almost like this is your behavior. Look at it. You know what I mean? I think people are starting to realize it's just not getting swept under the rug. But I mean, it is sad. I worked in the ER for a long time and had a couple of instances where I was assaulted. I've seen coworkers get assaulted. I've seen people just walking through the ER, not even having anything to do with us, be assaulted by people. It can be a scary place, but again, I try to focus on intention and try to have compassion to the situation, because otherwise, again, you throw your hands up and walk out the door. But that's not why you're not there for the one person that doesn't do what's right, and you hope that you're in the situation that if warranted, that you can press charges. That doesn't always happen, unfortunately, with healthcare, because, to be perfectly honest, it's their bad day, and you can press charges and they just get dropped. So we can't sugarcoat it. It is what it is. Should it be that way? No, but it is. And there's a second or a different set of circumstances when you assault healthcare workers in the hospital than if I was walking down the street and the same person hit me. I could press charges, but if the same person does it while I'm on my shift, I can't necessarily do that because they're under undue stress. And I'm like, I'm under undue stress. But no. Yeah, I mean, I to pretend that it doesn't happen it would be crazy. It's a fact of life. Again, I think it just goes back to emotional response. But I think having a good team, feeling like you're supported, feeling like you should never be in an unsafe situation. So if your gut instinct is telling you that you don't need to be with that patient, you don't need to be with that patient. You've got to take care of yourself. And if that means tagging in another nurse, grabbing security, grabbing leadership, whatever it might be, and you learn things, especially if you go into critical care. I mean, we're trained on how to, I would say, de-escalate, but it does teach you some things on how to keep yourself safe. You can't always de-escalate a patient, but you are taught things, so you're not just going in there with nothing baseline on how to keep yourself safe, how to keep the other patient safe, how to de-escalate the situation, and what your resources are. We were grateful. We had a off-duty cop all the time, so that was nice, and then that went away, and then it came back, and then it went away. But, I think just be smart and stay focused on what you're there to do.
Yeah, there was a situation that happened recently. So yes, I am very much familiar because our charge nurse got assaulted. So we were down the charge nurse, but we thought we were quick on our feet. Another nurse could be charge nurse. We switched. We moved that charge nurse to another bed away from the situation so she could get seen by the doctor, and we made do with what we could staffing-wise. The nice thing about our ER is that we have radios. This radio goes to everyone else, including our secretary and security can just come rushing in and help out. We always have a plan for patients who are violent, whether they come through the front door or by EMS. So like you need at least security, at least a tech, another nurse, because most of our techs are built like linebackers, which I am very much thankful for, and they can help us out. If we need to escalate, whether it's verbal or medically, we have that plan. The doctors are very much aware of that plan. So if there is an incident, we know how to kind of bring it up to both administration and also kind of keep us safe like in real time. So yes, the situation did happen, and unfortunately that person who did it was intoxicated, so we didn't see it coming. She just suddenly did it. But we were able to respond to the situation very quickly, and we got everyone safe afterwards. Unfortunately, yes, like it's just the part of healthcare, especially with the ER. We're trying to stabilize everybody, both medically and like mentally. Some patients just come on swinging, and we just have to sedate as soon as they get there because we don't want to have anyone else get harmed. And it is a lot to take in if you don't see it, if you've never seen it before. But once the situation is kind of like stabilized, then we see like, oh, this is the reason why this patient's like this, whether it's mental or sometimes it is actually a medical emergency that they had, and this is how like their brain responded. Like I remember there was a patient who was violent and it was a brain bleed. So we had to sedate, we had to intubate, we had to transfer to Chesapeake to have neurosurgery. And after that surgery, that person was normal, which is insane. Yeah. So yes, sometimes it is the person who's drunk. Sometimes it is the person who overdoses. But sometimes it is a legitimate medical emergency. And we do have to remember that. We just have to be able to remember how to respond to these situations. The nice thing is Bon Secours does have a workplace violence committee now, and they're making steps to put in plans for safety. I know there's metal detectors and all that, so we are making steps, but we are prepared to do what we need to do while we take those steps. So at least there is some kind of progress for us.
Okay, thank you all for sharing that answer to a very difficult question. We are right at about 7 o'clock, so I would like to see, do we have any final questions for our nursing panel here? Going once. Going twice. Okay. Well then, for those who have attended, well first of all, round of applause for everyone who participated. Thank you. And then with that, for our people who are attending online, if you are not already in contact with an admissions advisor, please feel free to reach out to me directly. My information is Jared Bishop, Director of Recruitment. My email is on the RSVP that you received. And for my people in person, you are now receiving a kind of an evaluation because we're always trying to do a little bit better each time we have a Pathways to Nursing event. So I appreciate your time filling that out. And with that, thank you everyone for participating. And for my people in person, I'm going to go grab your water bottles. Thank you, everyone.